Heather, thanks so much for joining us today.
It's a pleasure. As you know, I'm a researcher, an activist and a practitioner, so I think this conversation is really interesting in all those three dimensions of what I do.
So I know you wrote a paper recently with your co-fem colleagues. Can you tell us what you mean by practice-based evidence in that paper?
At the beginning of feminist activism, mostly it starts with women's rights organisations and women providing services for women who are living with violence. And within those services then, women talk about a lot of things. And what happened was, and happens still, is that the women in those services start hearing the same things over and over again. And that then becomes the data. And there is the capacity and the potential within that to theorise from that data and to make sense of that data. And so one of the things that I think is really important for us to go back to is listening to what women are saying in services and using that as a basis for understanding what they're exposed to, what they're experiencing, and how that functions, really, and reclaiming that feminist analysis of the data that's coming out of practice.
So how does a feminist theory of violence really help us with an emergency response?
I think when we have a feminist theory of violence, it helps us to understand that the power inequalities and the hierarchy of gender is manifest in multiple ways in patriarchy, and that's reinforced through violence. There isn't a place in the world where there is no violence against women and girls. It's a constant presence, and that enables us to predict that in an emergency or a crisis that will go up, because women are more isolated, more exposed, the mechanisms that they usually have are not available anymore, and they are much more vulnerable. So, for example, in the Ebola response in Sierra Leone and Liberia, the violence against women practitioners were very clear that we were going to see an increase in violence against women and girls because women's incomes collapsed because markets closed, there were quarantined areas, so women were isolated, the health services were all redirected to the Ebola response, and so services in relation to violence collapsed. And in those circumstances, when women have no money, they're really isolated, there aren't any response services, and they're responsible for providing care to people who are sick, it is inevitable that there will be an increase in violence, and that's what we saw. What was really difficult in that emergency was, because it was a medical emergency and the overwhelming response was a medical one, was getting that into the conversation around the response. It took a really long time to do it, and a lot of women died in relation to violence and not in relation to Ebola.
So what does it mean when we really only research specific forms of violences or types of violences?
I think one of the things that can happen if we're not careful is that we split off women's lives and women's experiences, and we forget that it is a woman or a girl who is living with all of this simultaneously. So an example of that would be the PSVI initiative, the Preventing Sexual Violence in Conflict initiative, which in some ways is incredibly important for recognising the role of sexual violence in conflicts, and at the same time, by only focusing on sexual violence and only focusing on it in relation to fighting forces or conflict, all the other violence that we know exists becomes invisible and becomes separated off. And so attention, resources, understanding is directed in a particular way, and that means we fail the women and girls that we need to be supporting, because women who've been raped by their husbands start thinking that because it wasn't by fighting forces, it wasn't a proper rape in the context of that discourse. And actually we know that private violence has a very much greater impact on women's lives, and so we can understand single violences much better, and we absolutely need to situate them within the context of how violence maintains and limits women's spaces to act within patriarchal social organisation.
So how do we come back to a feminist approach to research?
I think we need to stake a claim, actually. I think that the prevalence of public health approaches, and particularly epidemiological approaches around this, have been really helpful for kicking it up the agenda, for showing the depth and the breadth. And I think that we now need to broaden out how we generate research, how we think about what research is, and what we think knowledge is. There is a politics of knowledge that we really, really need to get into. Women are expert knowers. women know a lot. Women's rights organisations, women who've been providing services to survivors, have a fantastic amount of knowledge and are expert knowers, and I don't think that we recognise that enough. Sometimes there is a presumption that because women don't have research skills, they don't have knowledge, and that's a really dangerous assumption to make. So I think one of the things we need to do is come back to this idea of practice-based evidence, really privilege women's rights organisations and their experience and their knowledge, and share the research skills that allows them to put their knowledge in a way that it gets heard and it has validity and it has credibility.
So how do we support feminists in reclaiming our history and our scholarship?
I think a lot of this is around feminist organising of the kind that we've been doing forever. CoFem is one of the places that we can share this knowledge, have this conversation. We need to be unafraid, actually, to use the F word, and we need to be more explicit about how we talk about it and much bolder. I think that one of the biggest strengths of feminism is the solidarity and the working together and the not leaving any woman on her own to fight that battle. And so I think one of the most important things we can do is build the links with women's rights organisations, strengthen those relationships, build their capacity. Those of us that are in a position to distribute and allocate resources, to advocate, who have access to rooms and access to conversations that those organisations don't have, we need to be holding the door open. And I think as feminists, we have a very long history of doing that really well, and I think we need to come back to that.
Thanks so much for joining us, Heather.
It's been a pleasure.